Welcome back to my channel. This is the part 3 of physical examination, continuation of the other two videos. Okay, in this we are going to discuss systemic examination. I'm not going to explain in detail because the video is going to be lengthy. I'll just tell what all has to be right. Okay, so here the first one is the respiratory system. In this, first they have given inspection. In this inspection, symmetry. Symmetry means size. When the patient is inhaling and exhaling, the size of the chest you have to find out. In the example, if you tell, see in the COPD case, the chest expansion will be more than the normal. So that you have to find out and you have to write here. And chest movements, breathing is normal or a labor breathing, that you will find out with in the inspiration and the expiration. The chest movements you have to write it. With the breathing, how it is normal breathing or SOB is there or labor breathing, that you have to write here. Then respiratory rate, how many respiratory rates per minute, that you have to auscultation, you have to auscultate the breathing sounds. Okay, so here whether it is a normal, if you are hearing any abnormal sounds, that you have to write here. The percussion means when you are percussion the lungs, so there will be the this thing. If the flatness is there, that will indicate pleural effusion. Dullness, consolidation of the lungs. Resonance will be there. Normal, the percussion if you do, the normal sounds are resonance, and hyperresonance means pneumothorax. That you have to write whatever type of you are finding here. Then next is the cardiovascular system. In this, heart sounds, you have to see whether the sounds are murmur or broods. Broods means if there is any blockage in the heart, you will find, and murmurs means a disturbance in the blood flow, you will find the murmurs. Blood pressure, BP, you have to mark here. Heart rate, beats per minute, it means rate, rhythm, regularity, how it is there. Pulse rate means here you have to see the amplitude and symmetry of the pulsation. Okay, this will indicates the blood flow. Okay, that is about the circulatory system. Then gastrointestinal, in this inspection of the abdominal area, that color, what color it is there from lips. Okay, skin texture. Skin texture means whether it is a smooth, rough, that you have to write here. Distension. If the abdomen size is increased, means in the presence of ascites or umbilical hernia. Abdominal growth measurement you have to take with the abdominal tape, and how much it is, means units it will come, no, centimeters, that readings you have to write here. Then visible movements, whether there is any presence of bowel movements or abdominal aorta pulsation, that you have to write here. Auscultation, bowel sounds are present or not. If you are finding here, definitely it is present. If you are not finding, you have to auscultate and see present or absent. Percussion, you have to percussion and you have to do. So according to the find. Resonance means in the gas. Fluid, thrill, fluid, here pus. Dullness means any plus bleeding will be present. So according to that you have to write in what percussion you are finding, dullness or resonance, fluid, thrill or flatness. Palpation, mass, any mass if you are finding any hard mass, means it is due to the presence of any enlargement of the organ, that is liver or spleen. So which side, which quadrant it is you are finding, that you have to write. Tenderness means if the patient is complaining any pain to touch, that you have to write here. Then genitourinary system. In this inspection, external genitalia, you have to find it whether there is present or not, or any lesions like pustules, macules, whatever it is present, you have to write down in the external genitalia. Swelling means in the male is you have to see the scrotum and the penis size, and if it is in the female you have to see the labia majora and the minora. Discharges, is there any presence of white in the female, white discharge or green discharge, that for the females, males also, if the penis any discharges from the penis, that you have to write here. Urine output, whether it is normal, if the patient has catheter, IO chart you have to write down, means input and the output. If the normal means frequency, is you have to write. Okay, musculoskeletal system. Symmetric means size and shape. Strength. Activation means to do the range of motion exercises or movements with the patient is active or not. How much activation is there? That measures strength you have to find out. Then range of motion exercise. That if the patient is doing abduction, adduction, rotation, flexion, extension, that you have to write. If they having any pain to do this all the things that you have to write here. Findings, any abnormalities, if you are finding any joint swelling, fractures, dislocations, if it is present, you have to write here. Then nervous system. In the nervous system, describe any tics, twitches, paresthesia, means if the patient is complaining about numbness, twingling sensation, okay, loss of sensation, tingling sensation, if it is present, you describe it. Gait, walk, you have to see the walk, that the patient is able to walk straight line or in a drooling side, whether the patient is able to balance the thing, so that you have to write here. And reflexes, you have to do the examination of the triceps, biceps, reflexes, knee jerk movements, that all you have to mark here. So here they have asked about the, especially about the accessory nerve, CN11 nerve. So how you are going to find out this struggling? You have to ask the make the movements of the shoulder and turning of the head, like flexion, extension. If the patient is having any pain of that you have to write here. Coordination, like point to point movements, you have to ask the patient, and here you have to write down. Cranial nerves, you have to assess all the cranial nerves. If any abnormalities, if you are finding any nerve, that nerve only specifically you have write. If nothing you are finding, just you write no abnormalities found. Okay. About the integumentary system, here you have to write, ask color of the skin, either it is a pink or bluish, cyanosis, okay, that all you have to mark here. Moisture, if the skin is dry, combined, means oily or combined of both, so that you have to write here. Temperature, if it is a cold or clammy or hot. Vascularity or edema, if there is any swelling is there, varicose veins, varicosities is present or not. Okay. Skin turgor, pinch and you see skin turgidity, elasticity, you have to find out here. Okay. Then skin texture, whether it is a smooth or a rough. Okay, any lesions or breaks in the skin integrity. If you are finding anything, write it down. If you are not finding anything, absent you write. Examination of the nail colors. Color you have to find out whether it is pink or white or bluish. Shape you have to see whether it is a flattened or a spoon shaped. Okay, it is inverted like that. So that all, whatever it is present, you write. Strength means it is a break, means brittle to break, or it is a strong, that you have to write how the nails are. Okay, so this is about the systematic examination. I hope you people have understood the thing. We will meet in the next video. Thank you.